It's easy to get lost in the numbers, but behind every statistic is a human being. Let's talk about Mark, a man in his late 50s, diagnosed in the early 1990s. At the time, a diagnosis was a death sentence. He watched his friends wither away and die. He spent a year just waiting, planning his own funeral. But then, combination antiretroviral therapy arrived. He took that first cocktail of pills as a leap of faith. Slowly, miraculously, he started to feel better. Today he's a grandfather who runs marathons, his HIV undetectable. Then there's Elena, a young woman born with HIV. She grew up with the virus as a constant secret companion. Daily medication became normal. The hardest part was the loneliness, terrified to tell friends or partners. Consider David, a young gay man in a small, conservative town. He contracted HIV in his early 20s. Shame hit immediately. The turning point was a doctor who treated him as a person, explained U equals U. He's now an advocate for rural HIV awareness. Finally, there's Aisha, diagnosed during prenatal screening. Her first fear was for her unborn child. Treatment reduced transmission risk to less than 1%. Her daughter was born HIV negative. She faced stigma and protected the next generation with quiet courage. Alright, it's time to take some of the most idiotic, persistent, and dangerous myths about HIV and set them on fire with facts. These myths are not harmless. They perpetuate stigma and put people in danger. First up is the zombie myth. You can tell if someone has HIV just by looking at them. This is complete nonsense. A person living with HIV on effective treatment can look just as healthy, vibrant, and annoyingly good at yoga as anyone else. Next myth. If you're on treatment, you don't need safe sex anymore. Hold on a second. While someone with an undetectable viral load cannot transmit HIV, U equals U, that's not the only thing out there. There's still a whole buffet of other STIs. Syphilis, gonorrhea, chlamydia. Condoms remain your multi-tool for preventing STIs. Don't throw them into a celebratory bonfire just yet. Here's a classic from the 80s horror show. You can get HIV from kissing, sharing drinks, or mosquito bites. No. The concentration of virus in saliva is negligible, so you cannot get it from kissing. As for mosquitoes, when they bite you, they inject their saliva, not the blood of the last person they bit. Finally, the bleakest myth, an HIV diagnosis is a death sentence. This might have been tragic reality in the 80s, but it has not been true for over 2 decades. With today's therapies, a person diagnosed in their 20s has a life expectancy nearly identical to HIV-negative people. They can have careers, families, and grow old enough to complain about what kids listen to.